Good morning to our viewing and listening public, both home and abroad, and a very warm welcome to another Ministry of Health update on the national COVID-19 response. On our panel this morning, we are pleased to have Dr. Miriam Abdul-Richards, Principal Medical Officer, Institutions, Dr. Brian Amor, CEO, Southwest Regional Health Authority, and Ms. Michelle Ash, Chief Nutritionist, Ministry of Health. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health and moderator for this morning's update. Dr. Abdul-Richards will begin with the latest clinical, vaccination, and hospital occupancy updates. Good morning.
Good morning. Thank you very much, Al. To my colleagues, Dr. Amor, CEO of the SWRHA, and Ms. Michelle Ash, Chief Nutritionist, good morning. Good morning to all members of the media, and thank you once again for your continued attendance at our press conferences. And good morning to Trinidad and Tobago. Thank you very much once again for your listening and your attendance. This morning, I'll be providing updates as follows. The Trinidad and Tobago COVID-19 COVID update, number 845, as of 4 p.m. on the Sunday, the 12th of September, 2021. There have been an additional 135 cases, taking the total number of confirmed positive cases to 47,130. And this number represents the total number of positive cases from the 12th of March 2020 to present. Of these cases, at present, there have been 3,910 active cases, and they are distributed as follows. 3,443 persons in home self-isolation, 271 patients in hospital, and 71 patients in step-down facilities. Over the last 24 hours, there was confirmation of an additional 8 deaths, taking the total number of deaths to 1,376 since March 2020. And at this point in time, the Ministry of Health and our team would like to express our condolences to the families of the deceased. I'll now provide a vaccination update as of 4 p.m. on the 12th of September 2021. The total number of persons that have been vaccinated with the first dose of a 2-dose regime stands at 544,602. The total number of persons vaccinated with a second dose of a 2-dose regime stands at 431,899, with the total number of persons under a single-dose regime at 9,641. Therefore, the total number of persons with a completed vaccination regime is 441,540. And of course, a person is considered to be fully vaccinated 2 weeks after receiving the final recommended vaccine dose of a World Health Organization approved vaccine or a vaccine combination. I'd now like to present a summary of the status of the parallel healthcare system. And this summary includes the number of hospitalizations, occupancy levels across these 16 facilities in the parallel healthcare system in Trinidad and Tobago. This information was collected as of 8 a.m. this morning. So the first slide represents the gap between admissions and discharges, and you would notice that the orange line and the green line are very close together. This gap continues to be narrow and indicates a comparatively decreased burden on the parallel healthcare system. That is, over time and over the last 3 weeks, we have seen less additional persons admitted into the system, and this is a good indicator at this point because it indicates a decreased burden on the overall system. The next slide looks at the actual total net admissions per week. And I'd like to remind everyone that when we look at a week, we are referring to what is known as an epidemiological week, which starts on the Sunday of every week. You would notice that there has been a variable increase in net admissions over the past 5 weeks. And net admissions represent the difference between the admission of patients and those leaving the system, or discharges. We have recognized that as of today, which would be only 1 day into the week, the net admissions are 25. And so we have a 6-day period still left to really look at the overall impact of net admissions for this week. Net admissions are dependent on how quickly patients are admitted and discharged, and really dependent on how critically or severely ill someone entering the parallel healthcare system. The next slide looks at the actual number of COVID-positive patients who are hospitalized in the 16 facilities under the parallel healthcare system, 9 of which are hospitals for severely and critically ill, and 7 of which are step-down facilities for recovering patients. The total number of patients in the parallel healthcare system is 352. And across 9 hospitals, there are 279 patients, with 73 at step-down facilities. A 3-to-1 ratio continues to be a consistent trend, as we've been noticing, and we've noted that 3 times as many patients are severely and critically ill as opposed to recovering patients. This again emphasizes the need for COVID-19 prevention through vaccination, because it really emphasizes and underscores that persons with COVID-19 can become severely and critically ill and require ICU and HDU care. We will now look at the overall percentage occupancy of the parallel healthcare system. And the following slide indicates the total occupancy. And as of today, the total or overall occupancy is 34%. We have been noticing a slow but consistent decline in the overall occupancy, which has been under 40% since July 15, 2021. At this point, I would like to indicate that this trend can actually be reversed. So we are not to be prematurely comforted by the low occupancies. The next slide shows the percentage occupancy, and we use this indicator to confirm and to predict the capacity, and that is the availability and ability of the healthcare system to respond to an increasing number of cases. Again, a consistent trend is noted where only 1 of the 7 hospitals in Trinidad and Tobago for severely and critically ill patients is above the caution threshold of 75%, and that is the Augustus Long Hospital. With regards to the step-down facilities, of which there are 7 in Trinidad and Tobago, for recovering patients, all 7 step-down facilities are under 75%. Now we would look at the different levels of care for COVID-19 patients in this hospital parallel healthcare system. And at present, and this would be in the following slide, ward occupancy is at 32%, meaning that 3 out of 10 beds across Trinidad and Tobago are currently occupied. ICU is currently at 66%, and although this may appear to be a decrease, the overall or the average ICU occupancy for our most ill patients is over the last month has been 80%. HDU occupancy is at 38%, again with an average over the last month thus far of 57%. This indicates and really is the evidence that persons with COVID-19 may develop severe symptoms and will require ICU and HDU treatment. The last slide examines the number of patients in the traditional healthcare system across 10 accidents and emergencies. And we have noticed that at 8 a.m. every morning, there has been a minimal number of patients requiring admission into the parallel healthcare facility, and at this time this is a good indicator. Currently this morning there was one patient at the ERHA, one patient at the SWRHA A&Es, 3 patients at the Northwest RHA Accidents and Emergencies, and 3 patients at the North Central Regional Health Authority. In summary, I would like to remind everyone that vaccination is the key to preventing yourself and your loved ones from being admitted into the hospital. Vaccines save lives. Vaccines protect those who may live with us and work with us and who are unable to be vaccinated, such as young children. Vaccines prevent hospitalization, and even if you develop COVID-19, it reduces the risk of you being hospitalized and prevents or reduces the risk of you being admitted for high dependency unit care and intensive care. The best vaccine is the one available to you. We plead with you and we appeal to you to exercise social, personal, and civic responsibility. Don't delay. Please vaccinate today. Thank you very much for the opportunity to share this information with you.
Thank you very much, Dr. Richards. And you've heard it, vaccinate, vaccinate, vaccinate. The Southwest Regional Health Authority is responsible for the largest section of our population. I'm stating that being the primary healthcare provider for such a large and diverse population calls for proper logistics and planning. Leading this team of healthcare providers is its CEO, Dr. Amor, and we are pleased to have him here to update the nation. Dr. Amor, good morning.
Good morning, Mr. Alexander, Principal Medical Officer, Dr. Richards, Chief Nutritionist, Ms. Michelle Ash, to the listening and viewing public of Trinidad and Tobago, and to the team of the SWRHA, led by our board of directors, executives, management team, managers and supervisors, and to each and every member of staff who is either employed or assigned to work in our SWARA facilities. Good morning to one and all. I'm very pleased to bring a brief update in terms of the SWARA's vaccine administration program, and Dr. Richards would have covered the COVID parallel facilities for which SWARA contributes to the national effort. So as we proceed to the slides for the brief presentation, would like to alert the public in terms of our vaccine administration for our contribution towards the national effort with respect to the vaccination program. At the Southwest RHA, would like to highlight that the doses of the different vaccines that have been administered as at September the 12th, 2021, in total, we can say that excluding the Johnson & Johnson, we have given about 135,000 first dose shots, and of the second doses, that includes the Johnson & Johnson, because after the second dose for the 2-shot regime, you're fully vaccinated thereafter, and Johnson & Johnson, we have given 108,000 average doses thereabouts. So that's about close to 250,000 shots that SWARA has contributed in total towards the national effort. Inside there, those vaccines administration, there is the healthcare worker that's to the top of the slide. In the SWRHA, we are announcing that there's a 77% uptake of vaccines by our healthcare workers at this time. However, it is to note, as also stated in the national domain, that is the total composite across all our lines of staff, whether you're clinical or non-clinical or administrative or senior. It is to note that we still are working with the nursing team. The latest figures that I have is that they are about 56%, but which is an improvement from 1 month ago. And we continue to work with the nursing personnel, like the rest of the population, to really address any concerns that personnel will have. And we are very pleased that they have had increased uptake at this time. So as we move to the next slide, that has been our performance to date. These are just historical advertisements that are on our social media pages, but it is just to emphasize the point that accessing the vaccine is accessible. It really does not matter which type, but just for illustration, at this point in time, we have the Johnson & Johnson vaccine that's illustrated. You can check our media pages. That's available at all listed health facilities, and at these same health facilities, we also have Sinopharm vaccine as well. And on the right of the screen, that infographic shows our flagship sites, the Southern Academy for Performing Arts and the Penal Power Gen mass vaccination site. Has all the vaccine types there. As I said, it's a detailed flyer because since then, as we know, Pfizer has also offered in limited quantities to the adults in keeping with the Ministry of Health policy. So vaccines are widely available throughout the SWRHA, and that is at our fixed sites, which are our health centers and our mass vaccination sites. As we go to the next slide, we recognize that the population at this time, many persons simply don't want to just be told that they need to take a vaccine. They have questions. So there are several ways, and the Southwest RHA is following ministry guidelines that's in the other RHAs as well. But similarly for Southwest RHA, basically, if you need vaccine information to help you make an informed choice, come and visit any convenient health center. It's available in all. In terms of option 2, you could always check for the latest updates. If you are interested in taking a vaccine within the SWARA list of facilities, you could check our SWARA social media pages. You have a third option. You can simply call 87-SWARA. It's a toll-free number, and certainly any questions or concerns you have can be addressed in that forum. And option 4, which we'll go to, is that in addition to our health centers and our mass vaccination sites, we also have our SWARA Community Road Trip campaign to bring the vaccines even closer to the community, and particularly for those members of the community that cannot easily reach us in our regular facilities or mass vaccination sites. And that includes the National Mall Outreach, for which SWARA is a part. So as you go to the next slide, would like to indicate that part of our outreach starts for us at the SWRHA with our shut-ins, what we call clinically shut-ins, and our elderly homes program. The infographic on the left is also on our social media page. What we have found is that the persons defining a shut-in is somebody who's basically bedbound for whatever medical condition, and more importantly, requires caregiver support. So we are mindful that both the person who is not mobile as well as the caregiver who are depending whether they do it themselves or have someone do it for them on their behalf. That's a home situation. They want the vaccine, but it's difficult for them all to come. We offer that service to go out. And we do notice that, yes, we have that list of persons available from our health centers, but we know persons who don't easily attend the health center or attend private health care. They also have shots in. So this is a call to, again, utilize our infographic, and you could call us or send an email, and certainly just follow the directions, and therefore we will reach to you. In that regard, we have done 223 shut-ins thus far, and also just to note, as was said before, we have offered all the known elderly homes in the Southwest RHA, and we continue to encourage persons and their legal guardians in terms of the elderly to continue to avail of making an informed choice with respect to the vaccine. As we go to the next slide, part of in addition to the shut-ins and elderly program that's ongoing more recently, as we note that the public, apart from those who can easily access the health centers, really want us to reach them in other communities, and more so as well answer the questions. We also have our SWARA road trip program. On the left list some of the areas we've been to so far: Mamaral, Tudge Road, areas in New Grand, San Fernando, Ari Village, Point Fortin, Cedrus, and more recently, the Gulf City Mall and C3 Center. We will be publishing our list of itinerary weekly. We are happy to be guided by requests coming in from the public, particularly those through your local government representatives. So simply put, every week you could look, and we'll be coming to a location near you in addition to all what was said before. And as you go to the last slide in the presentation, at this juncture, at the Southwest Regional Health Authority, no single RHA, and that includes us, can do this alone. So we wish to thank at this point in the vaccination rollout campaign, for which Southwest is a part, all the MPs, the councillors, all the partner agencies, all the communities that has given us good positive and constructive feedback, the Ministry of Health, as well as even the media as well. So that represents the update at this point with the Southwest Regional Health Authority working together with the rest of the country in the national effort, and for which the vaccination, there are many avenues not only to access it, but to also find out more information about it so you can make your informed choice. Thank you very much.
And thank you very much, Dr. Amor. I now hand you over to Ms. Michelle Ash, who is no stranger to these updates. She will present on health and wellness, especially as it relates to persons living with chronic diseases. Good morning, Ms. Ash.
Hi, good morning. Thank you to my panelists. Thank you for inviting me today, Mr. Alexander, Dr. Richards, and Dr. Amor. So I'll jump right into what our topic is today. Our topic today will be healthy lifestyles and in relation to chronic diseases. So I'll just wait for my slides to come up. Right. So next slide, please. Okay, so what I'll be talking about first of all is our chronic disease risk factor profile in Trinidad and Tobago. This data was taken from something called what we call the National Risk Factor Survey that we did last in Trinidad and Tobago was around 2012 or so. The PAHO STEP survey, that's what they normally call it. And for Trinidad and Tobago, these were our statistics in terms of our risk factor profile. Our vegetable and fruit consumption was less than the recommended WHO guidelines, with 91% of us not even making close to what we were supposed to be eating. In terms of overweight and obesity, statistics are 36% respectively, and 25% for obesity. In terms of high cholesterol, we have 50.3%. That is half of our population having high blood cholesterol readings at the point when we checked. So these are very, very important statistics. Diabetes in terms of hyperglycemia at the time was seen as 20.5%, and persons with hypertensive readings, 26.3%. So as long as you find yourself falling into any of these risk categories, you would definitely need to ensure that you get vaccinated, because as you can see from these particular statistics, many of us are at risk. More than half of our population is at risk for poor outcomes if we do happen to contract COVID-19. And we do know as long as you get the vaccine, your outcomes will be a lot better if you do happen to contract COVID-19, and your chances, of course, are reduced with taking the vaccination. Next slide, please. And our top causes of death in Trinidad and Tobago remains heart disease as the number one killer, followed by diabetes and cancer running for a close second. And then we also have strokes at 9%. So in terms of our chronic disease risk factor profile, emphasizing again, get vaccinated as soon as you can. Next slide, please. So these are basic health indicators that everybody should know. In terms of yourself, you should know what your fasting glucose numbers are, blood pressure readings, your total cholesterol, your entire lipid profile. Simple thing as your waist measurement, your body mass index, body fat percentage. If you haven't checked any of these things as a male and a female, you should do so as soon as you can, because a lot of us are showing up at the emergency departments and we don't have an idea as to what these numbers are. So I wouldn't go into depth into the numbers, but you can take note of them. And I would mention why I'm talking about each of these particular indicators, particularly glucose, blood pressure, altered lipid profile, and high waist circumference. Once you have any of those, there's a particular diagnosis that you may get called metabolic syndrome. And this, once you're diagnosed with metabolic syndrome, your risk for heart disease, strokes, and diabetes is extremely high. Next slide, please. So in terms of body morphology, central obesity is something that puts you in that highest risk category in terms of metabolic syndrome. And it's one of the biggest indicators for that particular condition. So for men, they advise no more than 40 inches around the middle. And for females, no more than 35 inches around the middle. And if you have problems measuring it for yourself, you could just put the tape at your belly button for a good indicator. So you could always check at the same point to see where you lie. Next slide, please. So how about lowering your chronic disease risk factors? So there are a few things that we can't you can't alter your family history, your genetics, and we have a lot of strong genetics towards chronic disease risk factors in the country. However, you can reduce your risk by watching your diet, exercising, stress management, not smoking, a few others, alcohol consumption, reducing your alcohol consumption, and a couple other things you can do as well that I'll mention throughout this presentation. Next slide, please. And the good old 6 Caribbean food groups in terms of balancing your diet, your daily diet, you should be consuming from all of the food groups every single day. And with an emphasis on fruits and vegetables, at least get a minimum of combined 5 servings a day in terms of fruits and vegetables. That is actually what the WHO recommendation is in terms of risk factor management. Next slide, please. So in terms of eating a diet, a balanced diet, we'd like to emphasize fiber, nuts, seeds, and healthy fats. All of these things will help to reduce your inflammatory factors in the body, for particularly persons who may have contracted COVID-19, persons who would like to prepare their bodies so that they do not contract COVID-19. All of these factors are very good in terms of having fish at least 3 times a week, ensuring that you have peas and beans in your diet on a daily basis, either peas, beans, and nuts. All of these things contain healthy fats, they contain fiber, all of these good things that we require for managing stress factors and inflammation in the body. Next slide, please. So, comfort eating. So this is a particular topic specific to COVID-19 in terms of persons who are trying to manage their stress. Some tend to focus on eating and grazing all day long, and we would like to try to be a little bit more mindful as to what we put in our bodies. So in terms of ultra-processed food, we're talking fast foods, restaurants recently opened, and this is not a green light or a flag to say, okay, let's start eating everything that we missed for the last 3-4 months. No, right? Those foods tend to be high in saturated fats, trans fats, sugar, and sodium. So we really have to try to be a little bit more mindful as to when we're eating and when we're drinking. Next slide, please. So when you're buying pre-packaged foods, I'm advising, please practice food label reading. The last nutrients we talked about, the saturated fats, the trans fats, the sugars, and the salts, those are the things you're looking for on your food labels right there. You would also want to take a glimpse of the ingredients list, because sometimes they contain some other things that you may not exactly think you wanted to eat. So for example, if you're choosing a simple food, the ingredients list should also be very simple, maybe no more than 5 ingredients or less, depending on the food you choose. Next slide, please. In terms of added sugar, something that you're going to look for on your nutrition facts panel. So the recommendation for men for the day is no more than 9 teaspoons of added sugar. For women, no more than 6 teaspoons of added sugar. There's a lot of sugar in all of the locally produced pre-packaged foods, mostly all of them. We're talking, there's added sugar in our ketchup, there's added sugar in basically all our sauces and gravies, added sugar everywhere. The typical 16-ounce to 20-ounce soft drink contains about 17 to 22 teaspoons on average of sugar, far, far beyond the recommendations for added sugar for both men and women. And of course, for kids, they should have less than 6 teaspoons a day in terms of added sugar. Next slide, please. Sodium and salt awareness. This is another thing you're looking for on your nutrition facts panel. So in terms of teaspoons, there's about no more than 3/4 of a teaspoon of salt for the day is what the recommendation is. And then we have a nice pictogram here that depicts all of our locally high sodium containing foods in the country that you will want to be a little bit mindful of. So things that you may not think of actually contains a lot of sodium. For example, red mangoes, things like that. Corned beef, those are very high sodium foods. So you'll want to be a little bit moderate with that. Next slide, please. So snacks, what can we really eat then? So you don't always have to resort to prepackaged foods. There's a plethora of things available locally. You can try your hand at roasting some chana in the oven. It's Zabaka avocado season right now. You can have a little bit with that of that with bread, right? Bananas are nice and prepackaged already for you, right? Portugals, citrus, melons. So in the appropriate portion sizes, you can have very low calorie snacks, but they are actually very nutritious and filling and giving you all the packed nutrients that you require to ensure that your immune system remains strong and your body remains functioning well. Next slide, please. Alcohol consumption. Another thing that we tend to resort to for comfort and stress management, but this is not the best way. Binge drinking is really defined as more than 2 drinks per day for men, and for women when they consume more than 1 drink per day. And this is on a everyday type of basis. That's what we term binge drinking. So if you do drink alcohol, we stress in moderation. For those persons who are on medication, we advise no alcohol as much as possible when taking your medications as well. Next slide, please. Water consumption. So for most persons, it will vary a bit in terms of how much they work, how often they're in the sun, etc. But on average, most persons living in the Caribbean require about 2 to 2.5 liters of water daily. And this does not include water from, liquid from sugar-sweetened beverages. We don't advise this as it's a lot of calories and it will tend to add weight, unnecessary weight. Next slide, please. So in terms of exercise, we recommend, if you're continuing to try to be safe, you're wearing your mask, etc. Some persons still prefer to exercise indoors, particularly now, to still avoid their risk. So for most adults, 30 minutes a day, and kids as well, they have to ensure that they get their daily exercise with the minimum of an hour daily. Now that more things have opened, we try to stress if you can get as much activity 7 days a week, if you can go to at least an hour for both adults and children. If kids could get a little more, we advise this as well. But there are always alternative options. There are a lot of online resources available free. You can dance to your own music, skip rope. You can fill bottles of water and use that for strength training at home. So there's a lot of different resources that you can use at a pretty low cost. So we advise as much as possible to keep active. And this is for healthy body and healthy mind. Next slide, please. And that's the end of my presentation. Thank you very much for having me.
And thank you very much, Ms. Ash. I know I'll have to go back into my lunch bag and take out a few things this afternoon. Up next is our question and answer segment. We remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Please identify the panelists to whom you wish to address each question. And of course, we will accommodate a second round of questions if time permits. Today we begin the question and answer with questions from the Express. Express, good morning.
Good morning, everyone.
Good morning.
Leah Sorayas from the Express newspapers. My first set of questions is for Dr. Abdul Richards. Dr. Richards, the elderly continue to make up the majority of COVID-19 deaths being reported. Is there still a high prevalence of infections within residential care homes, or are these cases occurring among families in the private home setting? That's one. My second question, of the 85 COVID deaths reported so far this month, can you say how many occurred at hospitals and how many occurred within the home? Thank you.
Thank you, Ms. Soraya. I'll start with the first question, which details the source of infection for persons with residential homes and versus private homes for the elderly. Of course, being elderly and having comorbid conditions increases the risk of hospitalization for persons who contract COVID-19. That's why it's very important to vaccinate this group of persons, because it reduces the risk of them requiring ICU and HDU care, which of course may be a precursor to an adverse event. At present, the Ministry of Health is in the process of collating the deaths as well as the morbidity, which is the number of patients who are ill by location. And we do have a GIS, a Geographic Information System unit, which charts deaths according to addresses. So this question really should be forwarded to the Corporate Communications Department in order for an accurate response. The second question pertained to the 85 COVID deaths and how many were in hospital and how many were at home. Again, this information is currently being collated. Of course, we do get updates on a daily basis throughout the entire day. And at this point, again, I would urge you to address this question through the Corpcom department for an up-to-date and accurate number. Thank you.
And thank you very much, Dr. Richards. We now go to AZP News. We're ready for your questions.
Hi, good morning. This is Suan Wayal from azpnews.com. And to Dr. Armour, we have observed that several times particular vaccination sites in the SWRHAs had to be temporarily closed due to flooding issues. Given that we are still within the rainy season, what measures, if any, are the RHA putting in place to deal with these occurrences, whether infrastructural or otherwise? And to Dr. Ash, to Ms. Michelle Ash, what specific recommendations would you make to parents in terms of nutrition for children and attempting to have balance with all-day online learning and other types of physical or other activities, given that we are in the second week of the school term? Thank you very much.
Dr. Armour.
Okay, thank you very much for the question. With respect to flooding, the only site that has had a couple instances of it based on the weather and the natural terrain would be the Penal Power Gen site. Normally, we get reports like around 4 a.m. every morning when those instances occur. We check the number of feet of water and the likelihood it would recede, and usually between 6 and 6:30 a.m. we would give advisory to the public, always advising them as to when it is you could get the second dose. Despite the issues with the flooding, there's been a very good partnership with Penal Power Gen and the uptake by the community. Even though nationally, despite the initial high uptake, it has plateaued a bit in terms of the uptake, it is still subscribed. That's the only site that I'm immediately familiar with. Other instances where we have had a closure of health centers for general services, not only vaccine, occur in national adverse weather, but normally our resilience and recovery. We would watch, we always ensure that vaccinations take place. So I do know of a couple other instances, but that affected us nationwide, and depending on the weather patterns would normally tend to affect more the southwestern part of the country. So those are based on our fixed health center sites. So the only mitigation, whether it's like everyone else, we watch the meteorological service, we anticipate and plan, and most importantly, we communicate with the clients. So despite those challenges, overall, on most days, we do offer a range of services, and we do have a lot of sites that are available at any one point in time. So I trust that answers your question.
Thank you very much, Dr. Armour. Ms. Ash will take the second question.
Yes, so in terms of advice for kids who are now starting back the school term, I have a few tips for them in terms of nutrition and overall wellness. Ensure that you set regular meal times for children. This will ensure that in terms of grazing all day, that particular phenomenon, we have a little bit less of that. In terms of when you go to the grocery, probably try not to pick up as so many prepackaged snacks. Ensure that you involve your kids in the food preparation. Ensure you set times for what is work specifically and bedtimes. Ensure that those things are stuck to. Children in the kitchen, it's very important because you will be imparting skills on them that they can use for the rest of their lives. And as long as you involve them as early as possible, kids can go in the kitchen as early as 2 years old, right? And they can do some basic things. They may not need a knife and so on, but they can put together certain things. This will encourage good nutrition, good habits that they're forming, and they will find a better relationship with food when you start them off preparing in the kitchen. And this goes for boys and girls. So the myths that, cooking and kitchen is for only girls, that's not true. Boys, I know most of the men in my life, they are the best cooks, including my dad, right? So, mommy, you're not bad as well, but boys, they tend to cook very well. So, as much as possible, do some pre-prep of your meals. Plan your meals for the week. So it's not just when a day comes, you ask what to cook. This actually helps you do better grocery planning, better budgeting for your family as well on a whole. So plan your meals, plan your snacks, include pre-prep time on the weekends as well, so that you can plan out all of these things. You may want to include a few salads, a few fruit snacks as well. You wash everything and you put it in the fridge. So it's just a matter of taking out certain things, and you only have to cook a few things at a time. Freezing works wonders for big families as well. So that's my advice. Thank you.
Thank you very much, Ms. Ash. We now go to the Newsday for your 2 questions. Good morning, Newsday.
Good morning. This is Paula Linder from the Newsday.
Good morning, Paula.
I have 2 questions, one for Mr. Moore and the other one for Dr. Ash. My first question is, one of my coworkers on Saturday observed a man who collapsed in the observation area after getting his vaccine, and we wanted to find out
Could you
more.
Could you repeat the question, please? Repeat the question, please.
A colleague of mine observed that a man collapsed in the observation area at the T3 vaccination site on Saturday after he received the vaccine, and we wanted to find out more details about that incident.
All right, so the connection is really poor.
Are you hearing me?
Yeah, just speak slowly, just one more time, please. The connection is very poor. Just a little louder, please.
Sure. So a colleague of mine observed a man collapse at the T3 vaccination site on Saturday, and we wanted more details.
Okay, thank you. Second question. Okay, so Dr. Amor, I think you can address that question, please.
Okay, thanks for the question. As per medical ethical practice, we cannot comment into the details of any particular patient in the public domain. So what I'd just like to still emphasize is the general principles. We do have persons, and we saw it with the Pfizer as well, and it was mentioned in the public conference, where people would get what you call near fainting spells, whether it's due to anxiety related to the vaccine, and if even it's due to a medical condition. And we have everything that's available as per policy, all the resuscitation equipment, the medical personnel, ambulance close by. So there has been no long-term adverse events, and that has been brought to my attention, and that would normally be brought to my attention if there's any serious adverse event, and for which there is reporting frameworks through the Ministry of Health to PAHO and severe adverse events. So can't comment on individual details, but there is a protocol in place, and so far, at least for the Southwest, we have had no major untoward adverse event causing serious morbidity from the vaccination program to date.
Thank you very much, Dr. Amor. We now go to Guardian Media Limited for your 2 questions. Good morning.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so my both questions actually would be to Dr. Abdul Richards, if she could answer. So Dr. Richards, what is the protocol for anyone who may have had an adverse reaction to a first dose of a COVID-19 vaccine? Is it that their case is investigated and it's determined, okay, maybe you can go ahead with a second dose or even a different vaccine, or is it that we just outright say you had an adverse reaction to the first one, no more vaccines for you? And my second question is, over the weekend we saw reports on social media alleging that a 12-year-old child, I believe the age was, may have died after taking a vaccine. I just want to know if if there's any truth to that, or if it's being investigated by the Ministry of Health. Thank you.
Good morning. Thank you, Rashad. Your first question was about the protocols for adverse events and adverse reactions subsequent to vaccine administration. And I can assure you that vaccinations have been ongoing by the Ministry of Health for over 40 years, and all of us would have received some form of vaccination for school entry. So vaccines are safe, and they are accessible. And of course, we are guided by the World Health Organization's recommendations on vaccine safety and ongoing research in that regard. The Ministry of Health does have standard operating procedures and protocols for vaccine administration, as well as the management of side effects and adverse reactions. The regional health authorities would have trained and sensitized all categories of staff at the vaccine administration sites. We do have arrangements, that is an ambulance present on site, drugs and medication for resuscitation. We even have an observation time on the site where we have physicians and nurses observing persons after their vaccine. Now, if a patient or a person, a member of the public, has an adverse reaction or what they perceive to be an adverse reaction, they are to contact the Ministry of Health on 800-WELL or their primary healthcare center, or it could be via their personal physician, and information on the adverse event or the adverse reaction would be taken. This information is now channeled to the head office in the Ministry of Health, where we will do proper investigations. And depending on the adverse reaction and a case-by-case clinical assessment, a decision is made whether to continue with a second dose or whether we should continue with a different vaccine. Now, all of these decisions are made by the relevant clinical team, and also the information regarding mixing of vaccines, of course, was outlined by the Ministry of Health recently. Your second question was about an alleged death of a 12-year-old, and at this point in time, the Ministry of Health does not have any information regarding the death of a 12-year-old child post-vaccine administration. I would like to remind members of the population that vaccines are safe, they are accessible, they are available at our 109 health centers as well as mass vaccination sites throughout the country. And we urge you to vaccinate, please, in order to reduce the risk of hospitalization. Thank you, Rashad.
And thank you, Dr. Richards. We now go to 103 FM for your two questions.
Good morning, everyone. Sarah Chandu from 103 FM. I just actually have one question. Perhaps Dr. Amor or Dr. Richards could answer it. This weekend, our newsroom received a report from an elderly gentleman who was seeking a second Pfizer dose for his son. Now, he assumed that he had to return to Atto Boldon, where the first dose was administered, because he was not informed otherwise. But there was nothing there, and he was advised by someone there to go to UTT in Charleville, and there was nothing there either. So he says at that point they were very discouraged, and it brings up the matter of accessibility to information regarding the vaccination drive. Not everyone is as connected as we perhaps think they are, so what could be done to address that access to information issue, especially since not all of the vaccination sites are open every day? Thank you.
So I'll take part of this question. The Ministry of Health has a strategic communication plan that continues to be updated by our communications team. In the event of a change in vaccine sites, some sites, of course, would have varying closing times based on the demand for the vaccine and how often the vaccine is done. This information is shared with the public via the various forms of the media. I'll now pass across to Dr. Amor regarding the other part of the question.
Okay, thank you for the question. The list of the sites for the Pfizer second dose that was put out in a media release by the Ministry of Health, which included the sites in the Southwest RHA together at all sites nationally. So yes, there has been a recent updated advisory, and for which some sites that would have been offering the first dose are no longer offering the second dose. So that comment is duly noted. I would encourage persons to just simply check the Ministry of Health website, plus the individual RHAs, and as I said in the presentation, could also call as well in terms of getting the real-time update with respect to the any changes in the sites. But all sites and all RHAs, including Southwest RHA, those that are RHA-run sites, there are many sites available for the second dose. So that would be the answer at this point in time that we could offer in terms of response to your question. Thank you.
Thank you very much, Dr. Amor. And just a reminder, thus far there have been no deaths related to vaccinations from COVID-19 vaccinations. And of course, we on the 26th of August, we did put an update in a media release advising as such. And the public is advised that if they're to trust the Ministry of Health websites, the and social media pages, if you see rumors going around, please check on our sites to verify these rumors. All right, we do have accurate and up-to-date information on our website and social media pages. We continue with questions from CL Communications. Good morning.
Hi, good morning. Natalie Singh, Caribbean Lifestyle Communications. My first question is, Minister had pointed to a team from Trinidad who is supposed to have gone to Tobago. I was just wondering if they had come back yet and any sort of deliberations have been given and any sort of conclusions or plan for Tobago, given the fact that there are an increase in cases. And then secondly, my second question is, what is the state of the testing in the Trinidad Public Health Labs? Is there a backlog? I'm just thinking, well, the Brazilian variant is here, Delta is here, we've got some testing, a lot of testing happening. So I was just wondering, what is the state of the testing in the Trinidad Public Health Labs? Thank you.
Thank you very much. Dr. Richards.
Thank you, Natalie. Firstly, the team from Tobago, and that was a 3-member team of specialists, did return, and that was after a 4-day technical cooperation visit. The Ministry of Health continues to exercise its oversight across the 5 regional health authorities, of which one is in Tobago. And communication and collaboration is also done through the THA and the Division of Health and Wellness. So this was, as I said, a technical cooperation visit. Of course, Tobago, there are some concerns with respect to Tobago. It is a smaller country. The capacity would have been less given the small population and the small size. And the team would have worked with the Tobago officers, the TRHA and the THA, to really look at resolving and mitigating risks. I can confirm that plans are currently in place and arrangements to increase the intensive care unit capacity in Tobago as well as the high dependency unit capacity, and this is really in preparation for the Delta variant. Also, the number of ward level beds are being increased, improvements in the human resource function and the operational efficiency in Tobago. Now, just like Tobago has a limited capacity and a limited elasticity. We would have spoken at length about this, especially during May, and resources cannot be infinitely allocated. In this regard, we urge persons in Tobago as well as Trinidad to please be vaccinated. It is your responsibility. The onus is on you, and this is your way of really assisting the Ministry of Health, the THA and the TRHA in reducing hospitalizations. We are currently doing all that we can to save lives, but we need you to please vaccinate and don't delay. Thank you.
Thank you very much, Dr. Richards. We now go to the follow-up questions. Our first follow-up question would be from the Express.
Good morning again. My other question is for Dr. Abdul Richards. Doctor, can you forgive me if this was already addressed in a previous briefing, but can you say how many of the 7 people who were infected with the Delta variant have fully recovered? Thanks.
Okay, so the facts are that all 7 persons are clinically well and have recovered. Thank you.
Short and sharp. Next question. We now take questions from the Newsday.
Hi, good day again. I can settle.
Yeah, just speak up,
Good day.
please. Yes, just speak up
My
a little louder.
question-
Thank you.
Good day. My question is for Dr. Ash.
Dr. Ash,
I
yes.
just wanted to find out what advice you would give to people moving around in the excessive heat, and to follow up on the question of exercise for children. How does she recommend that they get enough exercise considering that they are in online school?
Can you repeat the first part of the question? Please.
Hello, are you hearing me?
Yeah, just repeat the first
The
part,
first part.
Of your question, please.
Please.
How do people deal with the excessive heat, and what advice for children in exercising as they are in school?
Okay, I still didn't get the first part of the question, but I heard the second part very clearly. In terms of exercise for children, at this point in time, places have opened out. For exercise, we can do a lot of outdoor activity with kids. If you don't get a chance to take them out every day, you can do it at least once a week. And if you have a small yard, you have small areas at home, you can buy things like a skipping rope. You might even have to buy, because you may have those things there as well. There's a lot of different activities. Play with your kids. Just run around. Allow them to do free play as well. So it doesn't always have to be a structured class where they get physical activity, but we advise free play as much as possible for kids. Thank you.
Thank you very much, Ms. Ash. We'll go back to Dr. Richards just to complete a response to Nadine Singh.
So, Nadine, apologies, we missed the second half of your question, and I'll respond to it now. So, your question centered about testing capacity at the Trinidad Public Health Lab. And I'd like to confirm that at present, there is no backlog at the Trinidad Public Health Lab. The TPHL, as we call it, is actually supported by testing facilities across each of our RHAs and even at the Queen's Park Counseling Center. So once again, I'd like to confirm that there is no backlog in testing at the TPHL lab. Thank you.
And I do believe we have time just to squeeze in one last question from GML. Short and sharp, please. Guardian Media Limited. Okay, so it's fine. Ladies and gentlemen, we thank you for engaging the media. We thank you for your questions and hope that the public would take heed to the information presented this morning by our subject matter experts instead of relying on misinformation often shared on social media. Please rely on reputable sources for information such as the Ministry of Health, PAHO, WHO, and the CDC for accurate and up-to-date information. In closing, we ask that you please continue to protect yourself and your loved ones. Remember, the COVID-19 vaccines are safe, they are effective, free, and available. No appointments necessary. If you haven't received your COVID-19 vaccination as yet, please get yours now. Don't delay. Vaccinate today. Be safe and goodbye for now.